Marion, and I give permission to do this video.
Yeah, you can be recorded. Say.
Oh, what is it?
You're okay with being
Oh,
recorded.
I'm okay with being recorded.
Okay. Knock, knock, knock.
Hi.
Hello, I'm Zach. I'll be your nurse today. I'll be doing your examination. What are we in here for?
A physical.
A physical? Okay. Real quick, can I just get your name?
Katie Marion.
Katie Marion. I'm going to verify that on my computer. And I'm going to verify on your name tag or your your bracelet. Can I also get your date of birth?
9/22/91.
All right. I'm going to verify that on my computer, verify it on the name tag. Any allergies, anything?
Nope.
No allergies. I'm going to check for the allergy bracelet. It's red, it says no. I'm also going to double check her MRN number on my computer, and everything checks out. I'm going to go ahead and perform hand hygiene. Going over to my sink. Wash, wash, wash.
Wash, wash, wash.
Wash, wash, wash. Okay, oven is on. All right, I'm gonna go ahead and close the privacy curtain so we can have some privacy. What brings you in today?
I'm here for physical.
Here for physical? Are you in any pain at all?
No.
Okay. I'm gonna ask you just a couple dumb questions. May seem stupid, just answer them for me. Do you know where you are?
Yes.
Where are we?
At the hospital.
What city are we in?
Orlando, Florida.
Okay. Do you know what month we're in?
February.
And do you know the President of the United States?
Donald Trump.
Beautiful. So I'm going to go ahead and evaluate ABCs. She's talking to me, so I'm going to assume her airway is patent. Looking at her work of breathing, she seems to be breathing just fine. Breaths are quiet, effortless, asymmetry in her chest as she's breathing. I'm also going to go ahead and check for circulation. Just checking for a quick radial pulse. Just checking your pulse, ma'am. Pulse is present, strong. Checking for cap refill. Refill is less than 2 seconds, so all that's all right. If you're okay with that, I'm gonna go ahead and get a quick set of vitals.
Let's do it.
Perfect. I also have all my equipment with me that I brought into the room. Go ahead and put that on that finger. And all that takes, we're gonna go ahead and put your arm right in here. Let's go. Stethoscope.
Do you want to restart?
No. All right, we got 132/80. Okay. And then pulse is 71, 98% oxygen saturation. We're gonna go ahead and check your temperature. 97.0, that is normal. All right, so far your vitals look pretty good, okay? I'm just gonna do a quick inspection. I'm gonna start at the top, work my way down. I'm looking at the skull, looking at her hair, looking at the texture, dryness. I'm looking for any missing patches, any inconsistency in hair distribution. I'm looking down at her eyebrows, looking at the same thing, hair distribution. Look at me, looking for symmetry. I'm looking at her eyes, looking at the symmetry of her eyes. I'm looking at the pupils. I'm looking at the conjunctiva, looking at the sclera. I'm making sure that it's not red or inflamed. I'm gonna go ahead and test pupil response. So So look straight at me. I'm gonna shine a light in your eyes, starting from the side. All right, pupils are equal and reactive to light. I'm looking at her nose, looking for symmetry. I'm looking for, anytime I'm looking at any of the skin, I'm looking for masses, lesions, anything like that. I don't see anything. I'm looking at her nose. I'm checking for any polyps, any obstructions. I'm looking for deviated septums, anything like that. I'm gonna have her open her mouth. Go ahead and open your mouth. I'm just checking for that temporomandibular joint, no clicking, anything like that. Go ahead, open your mouth, stick your tongue out for me. I'm just gonna take a look in her mouth, looking at her tonsils, making sure I'm not seeing any swelling, purulence, and anything obstructing airways. Everything looks great. I'm gonna go ahead and take a look inside her ears. I'm looking for cerumen impaction, any lesions, masses, as well as anything like that. I'm looking through all my skin assessments. I'm gonna go ahead and palpate now that we're done with our inspection of the head and face. I'm gonna palpate the sinuses, looking for any tenderness and crackling. So the frontal sinuses, looking for the maxillary sinuses, ethmoid sinuses. Anything? How's that feel? Feels good. Okay, good. So now that we're in here, I'm also going to go ahead and assess your lymph nodes. We're doing the preauriculars, posterior auriculars, coming down. Preauriculars, we're doing the jugulo-digastric right here. We're doing our submandibular, submental, right around here, coming down. I'm doing deep cervical, superficial cervical, coming all the way down here, doing the supraclavicular lymph nodes here. I don't palpate anything, there's no tenderness, so everything is normal. Ouch. Sorry. All right, so far so good. All the inspection looks great. I'm gonna go ahead and I'm gonna auscultate for lung sounds now. That's okay. All right. Go ahead and take a couple deep breaths for me. If that's okay, man, I'm just going to lift your shirt up a little bit so I can hear better. Go ahead. All right, again. All right, sit forward just a tad for me. All right, go ahead. All right, I'm going to listen to the posterior lobe, the upper lobe. And the lower lobes, posterior. So lungs sound clear asymmetrically. There's no asymmetrical movement of the chest wall. No adventitious sounds. Had vesicular sounds on the lateral fields. Bronchofascicular breath sounds on the upper lobes closer to the trachea. Everything sounded good. You have good lungs.
Thank you.
Okay, so that concludes your examination for today. I'm gonna go ahead and put the call light close to her bed. Raise the rails, but she doesn't need it. Call light, I'm gonna lower the bed for her as well. And I'm gonna go ahead and let your doctor know that everything sounds good. All right, have a wonderful, I'm also gonna perform hand hygiene before I leave, and that'll be it.
Good job.
Dang.